Welcome to Dr.M. Today we are going to see about OCD. What is OCD? Obsessive Compulsive Disorder. It's a common disorder of the mind. It is present in 5% of the population and equally found in both sexes, both men and women. Despite OCD being very common, people who suffer from OCD, they do not come forward and they do not seek help. The main problems of this OCD are in its name itself, obsessions and compulsions. What are obsessions? Obsessions are unwanted, repetitive thoughts that comes in one's mind. People with OCD very well know that these repetitive thoughts are very silly, senseless and excessive, but they are unable to control or ignore these obsessions. The more they try to resist and control these obsessions, the more it comes and causes very severe distress and anxiety to them. Ultimately, these obsessions disturb the inner peace of mind and it interferes with their day-to-day functioning. Now, what are compulsions? In response to obsessions, people with OCD, they start doing repetitive actions that are meaningless, unnecessary and excessive. These silly, senseless, repetitive acts are called as compulsions. For example, a person with excessive fear of corona infection washes hands excessively again and again and again. Persons with OCD are aware that their hand washing is clearly excessive. Still, they cannot resist their repeated hand washing. Why? Because of the temporary comfort and satisfaction they get from this hand washing, they do it repeatedly. Some persons carry out their own sequence of actions systematically in the form of rituals. For example, they start rubbing their nails first and then thumb, and they have their own set of rituals. So, on either changing the sequence or missing out one of the steps in hand washing, anxiety increases to them, driving that person to repeat the set of actions all over again. So, they start from the beginning. This would lead to waste of time and waste of energy and waste of resources. So, compulsions are meaningless. Now, many people confuse with obsessions. What are not obsessions? Certain things are not obsessions, but people use the word obsession differently. For example, he is obsessed with biryani. Many people tell this to me. Here, the person eats his favorite biryani repeatedly because he likes it and he gets pleasure out of it. Of course, the person has control over it. But in obsession, this is not so. So, the example of obsessions are excessive fear of getting corona, excessive doubts that a task has been done correctly or not. Some people get urges to abuse God with vulgar words. This is also obsession. Excessive concern with orderliness and arranging. They are very much preoccupied with symmetry, arranging, cleanliness, orderliness. Now, going to some common compulsions. For example, if you have excessive fear of corona, repeated hand washing with excessive soap usage and taking unusually long time to wash or take bath or cleaning items in the house, this is all example of compulsion secondary to corona obsession. Avoidance, for example, avoiding to touch the objects on the floor, avoiding to touch slippers, doorknobs, old currency notes, avoiding to touch window panes, avoiding to touch buckets and mugs, etc. This is also secondary to corona obsession. Checking locks and checking gas knobs, light switches, checking doors. This is response to doubts. Repeated apologies to God in response to cursing gods and doing certain things in a certain manner. People with OCD take a lot of efforts to maintain their image. This OCD is really a torture to them. Let's see a scene from a Telugu movie, Manmadhudu 2, in which the hero suffers from OCD.
మనం ఇక్కడే తినేసి తర్వాత సోఫాలో కూర్చుని టీవీ చూస్తే ఎంత బాగుంటుంది కదా.
ఓకే మిస్టర్ ఓసిడి గారు, మనం ఇక్కడే కూర్చుని చాలా పద్ధతిగా తిందాం, సరేనా?
Cheers.
Cheers. ఇదిగో బ్రెడ్. I'm so sorry. ఇది పట్టుకో, నేను ఇప్పుడే టిష్యూస్ తీసుకొచ్చి క్లీన్ చేసేస్తా.
చిల్ మనీనా, వెరీ వెరీ హాట్ ఓల్డర్ మెన్ ఇవన్నీ పట్టించుకోరు. నేను ఎంత హాట్ నీకు తెలుసు కానీ ఎంత కూలో నీకు తెలియదు కదా.
Oh shit. Pasta.
Because of OCD, the hero insists to eat in the kitchen itself, then tries and adjusts with a lot of difficulty and goes to hall and eats on the sofa along with the heroine. While they are eating, the heroine spills the noodles in the sofa and hero gets obsession that sofa is not clean and it disturbs him very much. He somehow manages his OCD and does not show it in front of the heroine. But late night, he gets up when heroine is asleep and he starts cleaning the sofa again and again with brushes, and he checks it with torchlight so that he doesn't even miss a tiny bit of food particle. But unfortunately, heroine finds him doing this compulsion from behind. So this is how people maintain their image. In part 2 OCD, we will see some more movie scenes and we will clearly understand what is OCD. We will also discuss about what is the treatment for OCD. Until I see you in the part 2 video of this OCD, it's bye from Dr. Dr.M. Thank you. Please do like, share and subscribe to our channel. Thank you.